In the heart of Mbakalo ward, on the outskirts of Bungoma town, something remarkable is happening. Communities are learning, growing, and thriving. And at the center of this transformation is Core Health and Wealth International. From classrooms to farmers, from health clinics to community workshops, we are empowering communities, nurturing young minds, and creating opportunities where they're needed the most. Through education, health, wealth creation, environmental care, and good governance, we are showing that real change is possible when people, communities, and support systems come together. This is a story of hope, action, and transformation. And this is the story of Core Health and Wealth International.
I want to go back to school and I want to be an engineer to get a better life and to help my mom and my family.
Naya
She
atusaidie
will help us,
ama
help her
asaidie mama
mother
yake,
and
asaidie
others,
wenzake,
and also
asaidie
help
na mimi
me,
kuhu
her
yake.
grandmother. At Core Health and Wealth International, we know that education is valuable, and for many families, it comes at a cost that feels out of reach. In Mbakalo ward, children with big dreams once stayed at home, not because they lacked potential, no, but because school fees stood in the way. So we stepped in, paying school fees for needy students, working with them through mentorship, life skill training, and guiding and counseling. Today, some of those children sit in tertiary institutions, carrying not just books, but hope. Their journey reminds us that when education is protected, futures are unlocked. We work hand in hand with government leaders, educators, health professionals, cooperatives, and the community itself, because sustainable development must be shared, inclusive, and locally driven. But a child cannot learn when they are unwell, and a parent cannot provide when healthcare is far away. That is why we chose to bring healthcare closer to home.
I am Cleophas Chesoli, Director for Core Health and Wealth, and today we are here to launch the Doctor in the Village initiative, where we are trying to bring quality healthcare services to the grassroots where people are. And the purpose of this is to screen so that we are able to know what kind of clinicians, specialists may come. The purpose is to avoid unnecessary travels to.
Through our Doctor in the Village initiative, doctors now come where once only long journeys existed. Through 3 successful medical camps, families have received consultations, medicine, and referrals for serious cases, all in collaboration with the Ministry of Health in Mbakalo ward, dispensaries, and committed medical teams. Health returned, and with it, the strength to work, to learn, and to dream again. For many families here, the land is their greatest asset. Through our Farmer Field School FFS program, farmers are trained in modern, practical, and sustainable agricultural practices. Learning does not happen in classrooms alone, it happens in the soil. Across Mbakalo ward, we have established 5 demonstration farms growing various crops, especially indigenous vegetables. These farms are open classrooms where farmers come to see, learn, and replicate what works in their own farms. Our demo farm stands as a living example of what is possible. Proof that when farmers are empowered with the right knowledge, food security, and income can grow side by side. Yet health and education alone are not enough. Families still ask a simple question: how do we sustain ourselves? Our answer lies in wealth creation rooted in knowledge. Through business training and microcredit support under the Micro BC initiative, community members have learned how to start, manage, and grow small businesses, turning ideas into income and effort into dignity. Still, some journeys need special care. Through our Teenage Mothers program, young mothers have been given second chances, returning to school, receiving peace support, or learning vocational skills when formal education is not possible. Boys are included too, learning life skills, responsibility, and purpose. And throughout all this, we do not walk alone. But as communities grow, we must also protect the environment that sustains us. At Co Health and Wealth International, we believe a healthy environment is the foundation of lasting prosperity. We have supported families with subsidized biogas system, reducing reliance on firewood and creating cleaner and safer homes. We have constructed toilets and latrines in schools, improving sanitation and dignity for the learners. And we continue to plant and donate indigenous trees, ensuring that the future remains green and life-giving. This is who we are, Co-Health and Wealth International, at the core of health and wealth creation, where education fuels opportunities, where agriculture feeds families, where the environment is protected, and where communities rise together. Our vision remains clear: prosperity in all, for all.